project that we've done is called Cook and Share, and the aim of the project is to help improve the health and well-being of local residents.
The aspect that we're addressing is because we're working with women, and from the EPIC report it stated that women in the Edmonton ward are expected to live 8.5 years less than women in other wards.
The project aims to address the social factors associated with the disproportionate development of heart disease, diabetes among the residents of Lower Edmonton, Upper Edmonton, Edmonton Green, Hazelberry, Turkey Street and Ponderson wards.
Dilio Junaka, the project coordinator for the Nigerian Catholic community, St. Edmund's Parish, Edmonton. We have been existing for over 25 years, and we are a voluntary organization that address community issues through our workshops, training, and we work in collaboration with other groups within the parish, like the Ancilla Soup Kitchen and Dementia Care. We promote health and well-being, community cohesion, and prevent isolation, depression that comes with isolation.
During the lockdown, we realized that our members were struggling a lot more than they usually would. With the new funding, we were able to continue with the work that we were doing, otherwise we probably would have to finish.
The change that we're looking for with this project is to equip the young people with a voice, and not only just a voice but the confidence to be able to have non-judgmental conversations when it comes to mental health and well-being in general. Within the black community, it's really spoken about, especially within our household, so that is something that I want to encourage more of and give them the correct tools and vocabulary to use when having these conversations.
My name is Tony Dallas and I'm the CEO and founder of Success Club, which is a children's charity working primarily in Enfield. The organisation's core vision is no child left behind. We work with the mantra of being better in the next second than you were in the last. We were set up in response to the idea that personal development is for everybody. And personal development can start from a very, very young age. And we wanted to ensure that we were doing that in primary schools. We went into 6 different schools over 6 weeks, and we worked with whole year groups. So some of them were 30 kids, some of them were like upwards of 50 kids, yeah? And every single week we gave them a different activity to do, whether it be team games, whether it be individual stuff, whether it be circuit training, but we made those things fun.
Moving forward with the Wellbeing Fund, we've arranged for a training at the National Bakery School, London's South Bank University, and it's tied in with healthy eating.
We have arranged presentations on prevention of heart failure, inflammation, prevention and management of type 2 diabetes, understanding the difference between type 1 and type 2 diabetes, blood pressure testing, nutrition, healthy diet, and healthy lifestyles.
People come along, we will have a variety of recipes, everybody cooks together, they quite often team up and make new friends, and then through the process at the end we have a variety of dishes and everybody sits down and enjoys a meal together, and it's a really good way of connecting over food.
With a little tweak, your lifestyle can change. You can become healthier, yeah? You walk a little bit more, you drink more water instead of drinking more Coca-Cola. Yeah, you have an idea of what you're putting into your stomach.
The 2 projects that being funded by EVA is the Health and Wellbeing and Managing My Money group, which we call 3Ms.
We also delivered 12 face-to-face yoga exercise sessions, and the average attendance was 32. We delivered 13 online yoga exercise sessions, and on an average, 48 people joined these sessions.
Following that, there's going to be a workshop on food labeling with a focus on nutrition information, because people have to understand nutrition information to be able to eat healthily and make the right choices.
What we also try to do is people quite often take the leftovers home with them, and we also create meal parcels. So we're really helping to those people that are suffering with food poverty at the moment as well.
In order to understand the needs and the extent of the support needs of our members, we don't always realize, and today's session was a really good example to see how simple things can be so difficult, not understanding their spending, what's their entitlement.
Okay, so every single week they look forward to coming back the next week. But not only did we do that, we got the teachers to actually look at what we were doing, okay, and enact that with them during the week. So by the time we came back the following week, we weren't starting again from the beginning. They had done stuff within the classroom, within the curriculum time, which is really, really important.
31 people reported improvement in their sense of well-being. 45 people reported feeling less isolated.
So the people that will benefit from this project not only are the young women that we're going to be working with, but like I've mentioned, their families, and then their peers as well.
The purpose of this project is to work with our members and give them the support and understanding that they can control their own money with support, and they should be able to make those decisions for themselves.
I found that young people, like to listen to other young people, and I think that that's a very important thing to realise and understand. So if we can educate, by educating these young women, we're then educating them to have the confidence and ability to have these conversations with others.
43 people reported as feeling more independent. The project activities supported 40 clients to access income-related benefits and housing.
By accessing this funding, what we've been able to do is help reduce the health inequalities. So our classes are free so that people can access these classes that wouldn't normally be able to do so, and particularly with children, that they don't necessarily have the positive role models at home to be able to teach them how to cook from scratch, and what constitutes a healthy meal.
In school, what we did was, one of the things is we got them to set up their own menus. Okay, so what would be a healthy diet, what would be an unhealthy diet. Okay, and once we put them up, then we were able to break down what was in what. Okay, which one would you choose?
The aim of this organization is to make people independent, and so that they feel that they can actually speak up when they need to.